Welcome to the American College of Surgeons Bulletin Brief from the front lines, Surgeons' Voices. The voice from whom we're going to hear today during this interview is my dear friend, Dr. Scott Levin, Chair of the Board of Regents, the American College of Surgeons. Scott, welcome.
Thanks, Steve. It's really great to be with you. For the last 8 years, you've been a wonderful partner in our time on the Regents, and we both have the opportunity and the privilege of leading as chair and vice chair. I mean, it's an equal partnership because of your prowess, your reach, your scholarship. And, it's a very special time for both of us, having lived through and living through the COVID crisis. We were just discussing a minute ago the so-called second wave, how we're coexisting with this pandemic. What are the implications for the college, the leadership position of the college over the last 9 months with yourself, David Hoyt, Corey Ashford in communications, our incredible presidential line with Wayne Meredith and Val Roosh and now Julie Freischlag. It's a really exciting time. People say this is the worst of times or the best of times. I choose this to be the best of times, despite the stresses that are upon us every day, what we're still facing, some hope with the vaccine. And so you and I decided, and I think wisely, with the college staff, with Wayne Meredith, with past President Val Roosh, and with Dr. Freischlag, our president-elect, it's just like the resident or the fellow that comes to you and says, I want to write 35 different papers this year on colorectal surgery. What you usually say is, let's take 1 or 2 projects and do them well. And if you can finish those and get them done and into the literature or disseminate new knowledge, that's great. But, let's not take on too much. So for purposes of the audience, what you and I decided to do is to concentrate on 3 things. With Wayne Meredith's leadership and Tim Eberlein's position as chairing the Regential Committee on Racism, that's one thing that is what? It's pertinent to every surgeon in the world to look at diversity, equity, inclusion, to look at racism. We can and will do better. And we've already started under Wayne's leadership with his passion, his self-study, the Regential Committee on Racism, to really develop this and make a difference. The second, so we have 3 things. Dr. Wexner and I have 3 things. Number 1, racism, which we're all in on, and they all interrelate. The second thing is what we call specialty engagement. As some of you know, I'm a proud board certified orthopedic surgeon. Steve, I'm smiling, recertified 3 times. I'm on my 4th longitudinal assessment program by the Academy of Orthopedic Surgeons, and I'm also a plastic surgeon. And so as a reconstructive plastic surgeon, I've had the opportunity the last 30 years to really interface with everybody in surgery, whether it's an orbital extirpation with an oculoplastic surgeon, it's providing a skin graft to the gynecologist for perineal work, with the vascular surgeons to cover an exposed graft. I've lived in the house of surgery, if you will, with my reconstructive interests. It's given me a great perspective on global surgery. And so I've made it my position, if you will, to following racism, to really concentrate on specialty engagement. And what does that mean exactly? You see, and our members see, how the House of Surgery was led by the American College of Surgeons, by Dave Hoyt during this pandemic. Many people around the world, disciplines around the country, look to us. When are we starting surgery? When are we stopping surgery? What are the criterion for intubation? Who has to be in the room? How do we partner to ramp up, ramp down, work with our anesthesia colleagues, work with nursing? So the college, yes, have I drunk the Kool-Aid, Dr. Wexner, about the strength of the American College of Surgeons? I have, because look at what we've done as a team, the college has done for this effort in the pandemic the last 9 months. And so point number 1 is racism again. Number 2, I've made it my business to champion specialty engagement. And here's why. 55% roughly of our members are so-called general surgeons, You're the preeminent colorectal surgeon of our time. But Steve, and you don't have to answer right now. Let me run on. What is a general surgeon in 2021? What is a general surgeon? We embrace and love our rural surgeons who are responsible for trauma care, for cancer care, maybe even the burr hole in a patient that has a subdural in a rural community that, they don't have a neurosurgeon there. But 55% of our members are general surgeons, however we define that. But 45% are the specialists, the gynecologists, the ophthalmologists, the plastics, neurosurgery, our oral surgery colleagues who do lots of head and neck trauma, lots of craniofacial trauma, take care of cancer. And so it's time, as surgical disciplines and specialties continue to evolve, that I would ask that we philosophically never give up the idea of the general surgeon, never give up the pillars of the college for education, for advocacy, serving members in the ways that we can, as we did during the pandemic, and optimal patient care, those things, outcomes, the quality programs, which are so essential, but they pertain to everyone. So here's the punchline. If you remember nothing, it's that the surgical specialties, it's our time. It's the time for the college to move forward on the tail end, we hope, of this pandemic and continue the reach to the surgical disciplines, all disciplines, in common areas. And let's point to racism. Let's point to advocacy. Let's point to the amazing work that Christian Shaljan in the Washington legislative team has done with Pat Bailey and Franco Pelka and others, representing not colorectal surgeons, not quote unquote, whatever the general surgeon means, but they've worked tirelessly with CMS, the Brunswick Group, the Surgical Coalition on behalf of every surgical discipline. This has merit. This has value. This needs to be disseminated as what the college is doing for all surgeons. I'll give you another example, and I'm the orthopedic surgeon. When the two-room issue hit coming out of Boston, and I think you know what I'm talking about, at the Massachusetts General Hospital, who was highlighted there, but it was orthopedics. Who came to the rescue of the two-room issue, referable to Senator Grassley's posturing to maybe reduce surgery to just one room? It was the College of Surgeons working for all surgeons. And yes, the Academy of Orthopedic Surgeons sort of weighed in and agreed to revise and embrace the college's position, if you recall, on the rules of conduct for safe surgery and staggered starts and things like that. But here was a specialty that created this kerfuffle, let's be honest about it, but who was right there, thoughtful, engaging, measured, process-oriented? The College of Surgeons that led. And you know me as your friend, I like to study leadership and promote leadership. And all of us want to be leading in our operating rooms, in our families, in our clinics, in our groups. And the College of Surgeons is a great leader. It's become even greater in the last 9 months as I see it. This is not to take anything away from our respective surgical disciplines. The Society of Thoracic Surgery, the Society of Colorectal Surgery, the American Neurosurgical Association. All these groups are represented in the college through the governors, through the regents, through our advisory councils. And so here's what I want to do this year with you and others. We want everybody to have a voice. We want those advisory council members that are sitting in general surgery or oral surgery to understand what we're trying to do in terms of our 3 goals. The third one I haven't mentioned yet, and that comes under your leadership. And you've been so exemplary and that is communication. You know, how do we send out information? How do we package it? How do we get it to our members? How do we get it to people beyond those that are members of the College of Surgeons? You know, we were just talking before we got started on the fact that I went to Britain. I was in London this afternoon, sitting in my office in Philadelphia, Pennsylvania, listening to a friend of mine give a talk on the wrist. Never could have done that I would have had to gotten on a plane and have been invited or gone there, taken time out of my practice. I was in London this afternoon. So we're looking at a new beginning, I hope, for the college. We're not throwing out our principles. We're not turning on a dime. But I would say to you, in terms of specialty engagement, the time is now in terms of what we're going through, what we've been through, the role the college played, the surgical coalition, lots of things that are happening that are generic to all surgeons. What we have decided, Steve, and what I think is obvious, yes, I want to recognize Ajit Shiva, the incredible educational offerings from the college in many areas. But what we recognize and we have to accept is that in terms of the college being the educator for everyone, I think those days are in some areas they're gone. I go to the American Academy of Orthopedic Surgeons or the Hand Society or the Microsurgery Society to either get my CMEs or get my education in that, but that's okay. That's the way things have evolved. But what the college can offer as the convener of surgery in terms of policy, in terms of defining quality, in terms of how to do work with big data, on how to look at principles of training residents, the red book that's been set up, the gold book, those kinds of things. The college reaches across all surgical boundaries to engage surgeons, and we can do better. And the way I want to do that is we have an entire army of surgeons. I'm a former Army reservist, so I use the term Army, but whole Navy or whole Air Force or whole group of Marines. I love the Marines. Starting with the regents, including the advisory council members, and certainly our governors. And each one of them, Steve, touches a surgical organization. Not all the members of that surgical organization are members of the college, but we need that aggregate group of maybe 250 people to be much more in the way of interacting with the college, go back and interact with their societies, big, large, small, intermediate, and let's work on some common issues. And that'll, again, strengthen specialty engagement. You'll be the guy that's communicating what we're doing. You're going to be the person that's going to reach all corners of the globe with information that's pertinent to all. But I think the time is now, coming out of COVID, that specialty engagement means that our governors, our advisory council members aren't just going to go back to their societies and say, here's what the college is doing, here's what I heard at the clinical congress. We want to hear from them. What are the things we can work on together? And I come back to the central issue that is going to be a start for us under the leadership of Wayne Murda this year and Tim Eberline representing the Regential Committee, and that's racism. There's not one surgical organization, and I'll give you the null hypothesis right now, that doesn't believe, and this is me saying this, that the issue of racism, diversity, equity, inclusion is not important in American surgery and global surgery. It is. It is. And we're going to prove it. And we're going to use that as a banner to get our advisory council members, our regents, our governors really working collaboratively and collectively towards something. They're going to work towards something. They're going to work towards a goal. And the person who's going to, not the person, excuse me, the entity that's going to be the convener of addressing this will be the college. We can get that done. We can get started. We can start looking at that. We'll get buy-in, I hope, from every surgical discipline. It doesn't mean they're not independent. They have their own boards. They have their own exams. They have their own education. That's all well and good. But we're always stronger together then we would be fragmented. In Washington, with the ACGME, with the American Hospital Association, and I come back to what you know and many in the college know, and that's a credit to the colleges, our reach, the reach of the college to be able to pick up the phone and talk to maybe HSS secretary, or who's in charge of CMS, or the American Hospital Association. We have those relationships that are going to be critical going forward as we emerge from the pandemic. We have new paradigms in education and new expectations for even how we deliver care.
Well, thank you very much. You've given us a lot of very, very valuable information. Your passion is apparent as you describe the various areas, including communication. Thank you very much. But certainly racism and specialty engagement. And although slightly longer than an elevator pitch, people can get a lot of good information, and people can select their reasons for wanting to support the college, whether it's advocacy, whether it's commonality in areas such as resident education, not the content, but how to educate residents, how to continue to educate ourselves, again, not content. And you've hit on that. I think you mentioned quite rightly the success of Drs. Opelka and Bailey and Christian in Washington with the help of all the fellows. Bringing together almost 30 surgical societies in the coalition is what brought home that victory that we just very recently realized, where instead of a 10% or 5% pay cut, we're seeing either parity or perhaps a 5% increase in some areas. Would not have happened without the ACS at the helm.
Here's where you come in terms of communication. It's this sort of shuttlecock diplomacy of our governors touching the societies they represent, the chapters they represent, the advisory members of groups they represent. You and I came up through the ranks, many of the regents did. I was on the advisory council. Then I became chair of the advisory council. Then I was a governor. And then I'm privileged and honored to be a regent over the last 8 years. And I've tried to touch the constituents that I theoretically represent. Sometimes, Steve, the parent organization isn't listening or isn't aware of what the college is doing, despite us telling them. I'm saying that we can do better, and we should do better. And that's the issue around communication. And I think, with your knowledge and interest in social media, with our young surgeons in every society being attuned to the utilization of this for information transmission, we have a new day ahead of us, and a very positive opportunity, I think, to start transforming a large, one of the purposes of the college. And that's as a convener, as we've done the last 9 months.
Well, thank you for your leadership. Thank you for your insights, and thank you for your time today with the interview. It's always a pleasure to see you. I always learn from you. I've worked, as you said, side by side with you for 8.5 years now, and I continue to learn. It's always a pleasure. I just long for the day when it'll be in person again, as opposed to remotely by video.
Yeah, let's not discount that. I mean, seeing a colleague, we talked about it this morning in our little seminar, having a cup of coffee, a handshake of a colleague you haven't seen from around the world, our ability for you to sit with, let's say, somebody who gets a scholarship in the college, who comes from an underserved area of the world, meets the great Steve Wexner. And I say that genuinely because of your reputation and how much you've given colorectal surgery and surgery your whole career. There is something to be said for that, other than being on a virtual platform. And we'll get back to those days, but we'll probably have a hybrid going forward. And as the supreme communicator, Dr. Wexner, we're going to let you figure that out.
Well, it's, as you said at the very beginning, it's partnership, it's teamwork, and with your knowledge and your leadership and our ability to communicate your ideas, my ideas, and everybody's idea, we'll certainly get a lot done. There is something to be said, a lot to be said about virtual communication. The fact that you're course that you've hosted every August for so many years, instead of 40 hands-on people, you get 800 people from around the world, would never have happened without COVID. So there is a silver lining to this cloud. Nonetheless, looking forward to getting together in person.
Okay, my friend. Great.
All right.
To meet you.
Stay well.
Thanks.